Spinal stenosis and balance problems often go hand in hand. When I see patients for spinal stenosis, I find out that a lot of them have balance problems or have fallen. And when I see patients for a primary complaint of unsteady balance or falls, I find out that a lot of them have spinal stenosis. But a lot of times they don't link the two of them together, and often neither does their medical team. But spinal stenosis and balance problems can often have a very cause and effect relationship. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain that cause and effect relationship between spinal stenosis and balance problems and some things that you can do to improve both of them. But before we get started, you have to actually understand a little bit more about the systems in your body that help you maintain your balance. The sensory systems that help you understand where your body is in space are primarily made up of three different things: your inner ear, your vision, and then the sensory information from your feet and from your joints. And they have to send information up to your brain, and your brain has to process all of that and then send out in real time a motor response to your muscles telling you how to react in order to maintain your center of gravity over your feet. So first, let's discuss the inner ear. Your inner ear has three sets of semicircular canals on either side, and those canals are oriented in three different planes. So it's kind of like a gyroscope that sends information to your brain telling you where you are in space. Now there's fluid in those canals as well as some little crystals. And when one of those crystals gets dislodged, it can send information to your brain telling you that you're moving or spinning, which is one common cause of vertigo. But a lot of times when people complain of balance problems, or especially when they use the word dizziness, whether or not they're actually having vertigo, that can send clinicians down a goose chase looking into different causes of inner ear dysfunction, doing spinning chair tests, checking for brain tumors, and all different kinds of causes of vertigo, when a lot of times patients aren't actually having that room spinning vertigo. Now, the second system that sends information to your brain is your eyes. We use visual information to tell us where we are relative to our surroundings. If you're in a room with stationary walls, or you can see other stationary objects, if you start seeing that the scenery is changing with respect to objects that are known to be fixed, your brain interprets that your body's moving. And your brain relies very highly on that visual information. If you've ever tried standing on one foot with your eyes closed, or even just maintaining your balance with your eyes closed, it's much harder to do that than with your eyes open, because we tend to rely a lot on our visual systems. Now, the third system that we use for balance is our sensory system. And that can be the skin and the receptors on the bottoms of our feet. For example, people who have diabetic neuropathy and can't feel the bottoms of their feet really well oftentimes can have balance problems. But it also has to do with the receptors in your joints, the ligaments in your ankles and in your knees and in your hips. And those ligaments, they have receptors that tell you the tension and where your knees and ankles and hips are in space. So for example, if you've had a joint replacement, you may not have those ligaments to give you the feedback anymore. And so that's another thing that can affect your balance. Now, all of that information, the sensory information from your feet and the information from your eyes and from your inner ear, has to go into your brain, and your brain has to process that. And then it has to send it down through your spinal cord to the muscles in your trunk and in your lower limbs to produce an appropriate response so you can react to changes in your body position and produce a force to help you maintain your center of gravity inside your base of support, which is your feet. But if you have spinal stenosis, you're not getting that incoming information. Spinal stenosis, if you don't know, is a narrowing around the spinal cord, or sometimes around the peripheral nerves that go down into your legs. And that can prevent the information from your legs, that sensory information, from flowing up to your brain. And so that's one system that you're already lacking, is that sensory system. But then it also inhibits the motor response of your brain sending information back to your muscles, telling them how to maintain your balance. And people with spinal stenosis, particularly in the most common areas, the L4, L5, and S1 nerve roots, those nerves send muscles down to your legs in the muscles that help pick up your toes, so you may get a foot slap or a foot drop. They also provide the strength to your gluteal muscles or your hip muscles, which is one of the main muscle groups that you use to help balance yourself. And so when you have spinal stenosis, that can inhibit both the incoming information to your brain as well as the outgoing information to your muscles. So what do you do about that? Well, I've got other videos that explain more in depth on how to treat spinal stenosis, but that's a big cause. Now, there are other things that can cause balance problems. Certainly, if you do have vertigo or if you have some blood pressure issues, those can all cause you to feel dizzy or be off balance. But a lot of times, just the weakness and the lack of sensation that you have from spinal stenosis can be a cause of balance problems and falls in older adults. Now, one really important thing if you do have spinal stenosis is to decrease the amount of arch in your lower back. When your back is really arched, that narrows the spaces where the nerves to your legs come out. It also functionally narrows how much room there is for your spinal cord inside your spinal column. And so by decreasing that amount of arch, you get more signal coming up from your legs to your brain, and you also get more signal from your brain going down to your legs. So just doing a little bit of a pelvic tilt or rolling your hips underneath of you flattens out the lower back and gives more space for the spinal cord as well as the nerves that run down to your legs. And when you are standing still, you want to kind of maintain that pelvic tilt. When you're walking, you want to lean forward just slightly to help keep that spine in a more neutral position. Now, as far as exercises, you can do balance exercises all day long. But if the nerve roots are being pinched and you're not getting that full signal out to your muscles, it doesn't matter how many balance exercises you do because the muscles just aren't going to get stronger if they're not getting the signal from the nerves to tell them to actually work or contract. So when you are doing balance exercises, you want to maintain that same spinal neutral position where you have your back a little bit flatter. Now, one of my favorite balance exercises for anyone, whether you have spinal stenosis or not, is simply just balancing on one leg. And the reason for that is most falls don't happen when you have 2 feet planted on the ground. They usually happen when you're on one foot taking a step or walking or going downstairs. So I think that's a really good place for most people to start, is to get steady balancing on one foot. Now, if you have spinal stenosis or balance problems, you probably do want to hold on to something. So using a chair to help you balance. And again, you can't have that big arch in your back when you're balancing because you're not getting the full motor signal down to your legs. So start out by a counter or a sturdy chair or something else that you can hold on to. Kind of tuck your pelvis underneath of you to get your body a little bit rounded out. And then pick one leg up off the ground with your spine a little bit rounded and just practice holding and balancing there. Now you can do it either with your leg in front of you or with your leg behind you, but the leg behind kind of more functionally simulates the position you're in when you're going from push off to taking a step when you're walking. It also kind of helps counterbalance you, that if you're leaning your trunk forward and putting your leg behind you, it maintains part of your body in front of your foot and part of your body behind your foot, so it helps you to balance a little bit more easily. It's kind of similar to the golfer's bend that more able-bodied people do, kind of going like that. It's just a little mini version of that. So again, standing by a sturdy object, rolling your pelvis underneath of you, leaning your trunk forward a little bit, and then just putting your leg out behind you. So that is the primary exercise that I would recommend for balance if you are having balance problems from spinal stenosis. Now, if you get really good at that, you can do more advanced versions like doing leg kicks, standing on one leg, going forwards and to the side and backwards. You can do that golfer's bend that I mentioned earlier, or little mini squats. But until you get really good at standing on one leg and can maintain your balance really well, that's probably really all you need to start out as far as exercises. Now, there are some tips that you can use when you're walking to actually help you improve your balance while you're walking. And the first one of those is just taking smaller steps. If you're really taking long steps, you have to be maintaining your balance on one leg longer. Additionally, when you take really long steps, if you've got stiffness in your hip flexor muscles, that will pull you into spinal extension and either cause back or leg pain or cause weakness in your legs so that you can't walk as long and you tire out and feel like you have to sit down. So taking shorter steps is a good idea so that you don't have to maintain your balance on one foot for as long. Additionally, when you do that, it kind of helps you to keep a little forward trunk lean so that you can open up the spaces in your lower back, and it'll allow you to walk longer before you feel like you need to stop. So that's the first tip to help you walk with better balance if you have spinal stenosis. The second tip is to keep your feet a little bit wider apart. I see a lot of patients who walk almost like they're walking on a tightrope, where their legs will come close to midline or even sometimes cross midline, where you may be apt to get your legs crossed and trip over them. And so keeping your feet a little bit wider apart. If you're walking on a wooden floor, you can pick two slats on that wooden floor and kind of straddle it, and then keep one foot on either side of that. And that'll help you to keep your feet a little bit wider apart. The wider of a base of support you have, the more side-to-side stability you have. If you have your feet really close together, then it doesn't take a lot of perturbation before you get knocked outside of your base of support and can potentially fall. So those were the tips to help you if you do have a balance problem and you do have spinal stenosis and you think they may be related together. And just to kind of review and summarize those, the first one was doing a standing balance exercise, holding on to something, tilting your pelvis, and leaning forward slightly with your trunk while putting your leg behind you. And then you can slowly let up on how much help you're using with your hand as your balance allows. The second tip is for when you're walking to lean forward slightly and take smaller steps. And then the third tip is to keep your feet wider apart to give you more side-to-side stability. So hopefully you did find those tips helpful. If you do need more help for spinal stenosis and you're in the St. Louis area, we'd be happy to help you out at More for Life. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. And in the meantime, here are some other videos to help you out with spinal stenosis and walking problems.